Dr. Rodica Pop-Busui. I'm a professor of endocrinology, metabolism, and diabetes at the University of Michigan in Ann Arbor, and a co-director of Neuropathy Center at the same institution. Diabetic neuropathy, it's a chronic complication of diabetes, and it's probably the most prevalent complication. Diabetic neuropathy occurs because of this toxic effect of diabetes and the entire peripheral nerves. The nerves are involved in the capacity of patients to feel various sensations like pain or to feel the touch of objects, to feel whether an object is cold or warm, among other things. All these nerves are also involved in controlling the function of very important organs. The cause of diabetic neuropathy is this damage and loss of this various population of nerve fibers. So the nerve fibers have various layers of protections, and the smaller the nerve fibers, the less protection against this glucose toxic effect of diabetes. But there are other risk factors that can damage these nerve fibers that are present in a patient with diabetes, including high blood pressure and high cholesterol, for instance. In general, the symptoms that mainly bring the patients to the physicians are pain, and that's actually a very important symptom. The pain can be perceived either as a burning pain or a deep-seated shooting pain. Other symptoms can also feel like pins and needles or like this numbness. Pain doesn't occur in everybody, and I think that sometimes pain can be good because that will prompt a patient to come to a physician. We don't really need very sophisticated tests to diagnose this complication. A 5-minute history to see whether the patients have any of these symptoms, especially this pain, but whether they have numbness, pins and needles, whether they feel very high sensitivity even at the touch of clothing or bed sheet, can be done in a couple of minutes. Then testing for these changes in the nerve fiber function can be easily done either by assessing the ankle reflexes, the sensation to vibration that can be easily done with a tuning fork in the office, the same sensation to pinprick, a push pin. It's a simple to use instrument, and you can actually assess whether your patient can feel that as being sharp. How can we prevent neuropathy and how can we treat neuropathy are two different scenarios here. We know, for instance, and we have done a lot of research, and we know for sure that in patients with type 1 diabetes, treating diabetes as early as possible and as close to normal as possible will help in preventing the development of this complication in a pretty large number of patients. In type 2 diabetes, because the disease is much more complex and there are other risk factors such as obesity, hypertension, high lipids, then the glucose control itself it's not so successful, but nevertheless it is important in newly diagnosed patients. Once patients have established neuropathy, unfortunately, as we speak now in 2015, we haven't really been able to find a successful agent that can reverse the disease from more advanced to less advanced stages, and that's why we need to do so much more work in this area, and we are working on that. So in more advanced stages, unfortunately, we have to try to help our patients by treating the symptoms, and pain by far is the one that is really challenging, and it's also extremely frequent, and there are a variety of ways to try to help patients with their pain. We can prevent this complication, and as researchers we are fighting without any pause to find better strategy to reverse the disease once it had occurred. In a team with the patient, with the educators, we can actually achieve a lot.